as she's just mentioned, I'm Elizabeth Jarrett. I'm with HHS ASPR, the Office of the Assistant Secretary for Preparedness and Response. I am also the last person standing between you and a glass of wine, and I recognize that, so I will attempt to be both brief and informative. We work with PHE.gov. And for those of you who didn't get an intuitive sense of that acronym, that is publichealthemergency.gov. We are your one-stop shop for public health emergency information during a disaster. This is a bunch of disasters that have happened over the last 12 years or so. Now I want you guys to think about hurricanes. We have hurricane season, it comes up every year. And we tend to think of disasters like they're these very unusual or unpredictable things that nobody saw coming. No, not so much. You've got, when hurricane season rolls around, we've had a hurricane every single year for the last 15 years. All of them. If you're going by seasons, that's more seasons than Survivor, Mythbusters, or NCIS. You actually have to go back to the year that the Jon Stewart show came on for the first time before you get it. Thank you. I love that there's some Daily Show fans out there. You have to go back to the first year of the Daily Show before you get to a hurricane-free year. And it's not just hurricanes. You have floods, you have explosions, you have terrorist attacks. I mean, pretty much we cover everything but locusts. And all of those different areas have public health consequences that are tough to manage and require various parts of the federal health infrastructure to manage. So, disaster happens, and all of these people realize with stunning clarity that they don't know stuff. Hands go up all over the place going, what am I supposed to do here? Can I eat that? Am I allowed to use this insulin that's supposed to be refrigerated? The can you eat that question? I can tell you I'm a former Peace Corps volunteer. My husband's a germaphobe. There are very different answers to that question when the power goes out in my house. And however, the FDA has gone through research to come up with answers to these questions. And what we need to do is direct people to the information that they need. According to the FEMA 2011 household survey, only 14% of people have both done the research to figure out what preparedness is and actually taken a couple of those make a kit, get a plan sorts of steps. So we're not looking at a bunch of people who are ready to go here. By providing a one-stop shop, we're doing two things. Very similar to what you heard earlier with healthcare.gov. We've got one place that people can go to for health and safety information. An emergency is a time when people are stressed out, they're low on battery life, and they're really short on patience, and they are not looking to get a civics lesson. So they don't want to hear that, although they were looking on the CDC site, the information for food that I was just talking about is actually over at FDA. So we give them one stop to go for that. Sometimes people do know what they're looking for. Sometimes, maybe you need mold remediation because your house flooded. Cool. You go to PHE.gov to find that information. You'll also find that, hey, there's a section on taking care of your mental health needs. Well, maybe you've been too stressed out to really stop and think about how this is affecting your mental health or the mental health of your kids. But we got a quick fact sheet that we did not write, very similar to healthcare.gov. We are not the end-all and be-all for answers. The folks over at SAMHSA have done the research and the tail-end work to make that fact sheet fantastic, and we would not waste government resources by trying to copy it. They are a wonderful partner for us. We are ASPR. As I said, we're the Assistant Secretary for Preparedness and Response. We lead the country in preparing for, responding to, and recovering from the adverse health effects of disasters and emergencies. We also work with our partners to get information, the information that people need when they need it, to them as accurately and as quickly as possible. And we particularly are concerned about our most vulnerable populations. It's one thing to make sure that everybody knows what they need to do, but making sure that kids know what they need to do, or having information for people who are dependent on durable medical equipment or who need insulin. All of those people have special needs, and we're giving them one stop to come to for help. While people are looking at our site, We also realize that there are a lot of people in any disaster who really want to help. Unfortunately, you can't show up with your medical bag and a bandana and say, I'm here to help. You actually need to be registered. And this is a huge lesson learned that we keep relearning every time we have a disaster. So we tell people, you want to help, that's great. We have the emergency system for the advanced registration of volunteer health professionals. Go get credentialed, and the next time bad things happen, we will call you because we got your phone number now. The National Disaster Medical System does some similar things. They're intermittent federal employees that we call up whenever disasters happen. We work with our partners on the development and distribution of high-quality content. This is what we put out during Sandy last year. I assure you ASPR did not write most of this. We had folks over at CDC who are our experts and our go-to guys on all of our public health and safety information. You want to know about the exact concentration of bleach that you need to clean your house? The folks at CDC will tell you about it, and they'll make sure that you know and that you're on the right path. We made sure that people had information on where they could go to stay cool, and then later on in the storm, warming shelters when the snow came in, and we had never seen that before. You know, we have hurricane playbooks, and we exercise all this stuff, but we've never had a disaster where snow was an issue, or a hurricane where snow was an issue. But we relied on our partners to get through all of this content and get people the information that they needed. As I said, I'm Elizabeth Jarrett, and you can find PHE.gov online. You can find us both at our website and through our social media platforms on Twitter, Facebook, YouTube, and now on Clipper. Thank you so much for your time, and I look forward to your questions.